We'd like to welcome you to our Family Survive and Thrive Guide of the Coronavirus Care Community of Practice. We're so excited to have all of you attending. We have a great turnout today of many families. The title is Coming Home Safely, and we'll be addressing the hot zone, warm zone, and safe zone of coming home. My name is Charles Denham. I'm going to be your moderator today, and it's such an honor for me to be the spokesperson for a terrific group that you'll learn more about as we go through the program today. I'm on slide 3 for those of you that have the slides, and those that do not, you'll be able to download them off of the link on the website that you may go to then return and watch later and listen to the webinar, and it'll be streaming as a video. Just to let you know, turn up your computer volume to the max, turn up your speaker volume to the max, and turn up your WebEx volume to the max if you do not have good audio. If you have a problem with that, you can click on the participants panel, and there's an icon for a telephone, and that is the request phone, and we can give you a toll dial-in number that can give you a good line. We'll start off with just our purpose, mission, and our core values. Our purpose is that we measure our success by how we protect and enrich the lives of families, patients, and caregivers. Our mission is to accelerate performance solutions that save lives, save money, and create value in the communities we serve and the ventures we undertake. Our core values are spell I care, integrity, compassion, accountability, reliability, and entrepreneurship. And this set of core values, mission, and purpose are through all of the initiatives that we undertake through a nonprofit that I had the honor of starting about 35 years ago. We have 3,100 hospitals and 3,000 communities, and a number of caregivers that ranges anywhere from 25,000 to 80,000 who are invited to our webinars. And this program is one of the first that we focus on families of essential critical workers. We have 500 subject matter experts that serve this community as well. We have a disclosure statement of financial disclosures. There are none to declare. However, there are some declarations of some relationships. No product, service, or technology will be discussed, and there's been no funding from the healthcare industry. It's purely funded by philanthropy, by a family fund. It's such a joy to have this wonderful group of speakers and reactors. We have Jennifer Dingman representing patients and families, a longtime patient advocate, Dr. Gregory Boats from both MD Anderson and on faculty at Stanford Medical Center, Ann Rhodes, the co-founder of JetBlue and CEO of People Inc., who will talk to us about core values and why they're so important, David Beshk, world-class educator, scout leader, and a leader of our MedTac bystander rescue care program, Heather Foster, who is a nurse preventionist who has made enormous contributions to our prevention work. Dr. Christopher Peabody, Toth Peabody is at the University of California, San Francisco, an emergency medicine doctor on faculty there and leading an innovation center. Dr. Casey Clements can't join us today, but he is a contributor to much of the content and leads the entire medical emergency medicine services at the Mayo Clinic Rochester, and also has a PhD in microbiology and immunology. We have Chief Bill Adcox, the Chief of Police at Houston and at the University of Texas, as well as the Chief Security Officer of MD Anderson, which is named #1 again in the U.S. News and World Report as the top cancer center. An honor for me to have trained there. Matt Horace is the Chief Security Officer at the Mayo Clinic, also named #1 as the top hospital, and wonderful place where I had the opportunity to learn. Randy Steiner, who is the Director of Emergency Services at the University of California, Irvine. Paul Bataille is a pre-med student who is a terrific EMT and president of the EMT Association serving the University of California. Dr. Bill Scharf, who is the patient safety and quality leader for one of our great healthcare systems, Advent Health, and John Tomlinson, who is both a JD, has an MBA, and is a business leader as well as scout leader, who has been a great contributor to the work. So that's a quick pass through on who we have today, and we always start off with the voice of the patient. This is our 144th webinar of 90 minutes that we deliver for free to the community. We've delivered 140 to doctors, nurses, and pharmacists in the area of patient safety, and have hundreds of hospitals join us on the third Thursday of every month. Now we're starting this program for families on the first Thursday of every month. So the third Thursday we do a webinar. Now we're doubling down and leading this, and we love having Jennifer Dingman be the voice of the patient. She's been a long-standing champion of patient safety. She was one of the winners of the Pete Conrad Global Patient Safety Award, and worked with us over the last 11 years, actually, focused on reducing medical error and especially the hospital-acquired conditions. And the work that she contributed to has saved more than 175,000 lives and in the tens of billions of dollars. So, Jennifer, thank you for your steadfast support, and please be our voice for the patients and families that are being served today. Jennifer?
Thank you, Dr. Denham.
There we go.
It's a pleasure to be here. I'm very excited about today's webinar. This is so important for patients and families to learn how to deal with this crisis that we're going through right now with this coronavirus that has just swept through the world. It is great that we're going to have such good experts, such wonderful, knowledgeable people from medicine helping us learn what to do and how to deal with this. The last webinar was fantastic. We got a lot of great feedback from other patients and families. And I just want to thank everyone who's here listening in. Please share this widely once the recording is available, and invite other families and also providers to work with us in the future to come to these webinars. I'll hand it back to you, Dr. Denham, and thank you again for doing this.
Thank you, Jenny, and thank you for all of your great work. We're going to talk about a lot of good news today on the webinar of things you can do. I guess we have to start off with the brutal facts, and Ann Rhodes, who's one of our speakers, is a colleague with Jim Collins and I working in leadership, the fellow that wrote A Good to Great, and one of the things he talks about is the Stockdale paradox, which is face the brutal facts and then declare you will prevail. And General Stockdale was in Vietnam in a prisoner of war camp. The brutal facts are that this is the coronavirus crisis is probably the greatest public health disaster ever happening in the world, and we're really at the bottom of the list. You can see Canada, which is 1/10 of our population, and you can see their numbers on this slide. So we have a lot that we can do. If you look at the hot spots around the world, and you look at the intensity of the colors on the Johns Hopkins recent program, and you can go to their dashboard every day and see the growth in numbers. We're at the bottom of the list of performance. We have the greatest growth in deaths. We really have a long way to go. That said, is the bad news, that we have 100,000, over 1,000 deaths a day. Hopefully we'll see some of the numbers drop. But if you look at South Korea, that had their first case when we had our first case, they've only got just a little over 300 deaths, and we have north of 150,000, close to 160,000 deaths and growing. So we have a long way to go. Now, that's the bad news. The good news is that you can't rely on the Public Health Department. The Public Health Department of the United States of America, your local Public Health Department, your state Public Health Department have to make trade-offs for the population. There's a certain cost to doing business to take care of everybody. The great thing about what we have to share with you today is if you take charge and you focus on your own family and you put together your own health security or health safety plan, which we recommend companies do as well as families, there's an enormous amount of impact that you can have to keep your family safe, reduce cost, reduce harm, and really get back to somewhat of a new normal. We're going to cover a number of questions. I can see with my dyslexia, I missed a T there on safety. But these are the questions we're going to cover. How do we keep from bringing the virus home? What are the best practices to protect my family? What if I'm exposed to a COVID-19 patient at work? Things are changing all the time. We need to keep up on it. How do I put together a family safety plan or a family safety program? Can we have safe play dates? Why are indoor activities so much more risky than those outdoors? What personal protective equipment, PPE, do I need to have to take care of a loved one at home? You'll be surprised when you learn about some of the things that you can do. How do we get teens and those in their 20s and 30s to take the lead in being safe and protecting their families? They're the biggest, they're the super spreaders in our community right now. What if a contact tracer, an individual who finds out that you've been exposed, calls and you find one of your family members have been exposed, and what should be on my family what if list? If we're going to take charge, we need to know what the what if list is. So one of the most exciting things to me about the work we're doing right now is you're a combined audience. You're an audience of doctors, nurses, caregivers, administrators, nurse preventionists, a number of healthcare workers, EMTs, lifeguards, but you're also families in the general public. And as I'll share with you in a minute, our big discovery was you all want to be trained together. Now, the dilemma is we're going to toggle between some pretty detailed slides and some high-level graphics. And the reason is we've got to both thread the needle of providing the evidence-based medicine to our clinical colleagues or our professional colleagues, and we need to provide the family-centric view. And I always think of my son, Charlie, who's 14. Can I explain it to him, or even the kids that Mr. Bashka and I, David Bashka and I, teach when I teach our MedTech program? If we can explain it in language they understand, then everybody can understand. And this can be done. We've done it with two of our broadcast documentaries that we've done with Discovery Channel. We're going to address the hot zone, the area where we're most exposed. It might be in the public for your family. It might be where you work. It might be where you play. The warm zone, or what Dr. Boats and I visited this morning about, the transition zone. Where do you disinfect? Where do you get rid of the virus if you're bringing it home? And especially if you're in a high-risk field like law enforcement, where our two world-class security leaders are going to share the dilemmas and challenges that their workforce at major medical centers have in law enforcement, where they are constantly in a high-risk environment, or our caregivers are. And then the safe zone. How do we maintain that safe zone and keep the virus out of that? And you'll notice there are two icons in the warm zone. One is the car. You may not be able to disinfect at work. Dr. Peabody and Dr. Boats are going to share how they disinfect when they come home. They have different ways to do it because of what's going on at the hospital. Sometimes we have to do it at home. Well, that means your car is contaminated, and so we have to keep that in mind, especially when we're bringing kids home from school and those things. So this is a high-level graphic. We're going to get into more detail. Now, every one of these webinars, we're going to generate a written guide that you can go back and read that will come from the transcript and more major work that we'll do, and we call them Survive and Thrive guides. This one is Don't Bring It Home, and when we next week, by the end of next week, we'll have that for you, and by the end of the weekend, we'll have one on masks, because there's some breaking news yesterday. We were going to deliver it today, but we're adding some things that Dr. Fauci said yesterday. So we're going to have a series of what we call Survive and Thrive guides that will be coupled to video. If you want to watch the video and then print out the Survive and Thrive guide, great. If you just want to print it out, fine. Some people learn by videos, some by images, some by graphics. We want to cover everybody. So just a real quick background on who we are. We put together what's called the MedTech Bystander Rescue Care Program 5 years ago, and actually Dr. Greg Boats will speak next with Heather Foster. He suggested at the end of a telephone call that I had with him when I was putting an innovation program together for Texas Medical Center in Houston. He said, I'd like to share a passion project with you, and it was regarding active shooter events. Well, I did a lot of research in that. We as a team did a lot of work, and it evolved into a bystander rescue care program focused on the 8 leading causes of preventable death. Big surprise, as of this spring, the coronavirus crisis jumped right almost to the lead, and today it is in the lead of preventable causes of death. So we focus on cardiac arrest, choking and drowning, opioid overdose, anaphylaxis, which is the reaction that our bodies might have to agents that can cause us to need to have an EpiPen, major trauma, including active shooter events, infection care. This is where coronavirus lands. Transportation accidents. There are 100 drive-over accidents in schools and in driveways every week. 4 children die. Over 60% of them are the drivers or their parents. We found it to be a great area to focus. And then bullying, including bullicide, where this leads to the death of children. We have a number of initiatives, same core values. We're undertaking an emerging threats community of practice with major medical centers in collaboration with the World Health Organization. We have an outreach program for educational material that is called Global Patient Safety Forum. Safety Leaders is the program I had referred to earlier, where we do a webinar at the third Thursday of every month, and many of our speakers here today speak to doctors and nurses on pretty complex areas of medical harm and medical error. And Care University is just our platform to deliver licensure credits and things that you need and certificates. But we focus on what we call the 4 Ps. If we're going to keep something from happening, or what we call left of boom, when something bad happens, we focus on prevention, preparedness, protection at the time when an event occurs, and performance improvement. What can we learn? And that's what this community is about. So there are articles which you can download from our website regarding the work that we've done in our Adopt a Cove program, for instance, here in Southern California, where we're putting rescue stations at a number of coves. And you can read about the program here. Mr. Bashk, who will speak today, and my son Charlie and I are in the picture in this one article, the first article that was written, and it actually showcased the fact that Mr. Bashk saved the first life in the first 7 weeks of the program teaching lower school children. He learned something on a Thursday, saved a life on a Saturday. So what happened when the coronavirus crisis hit, we looked around and said, who's training the families? Who's teaching the families of these 16 industry sectors, these sectors that keep the lights on, the water flowing, the information flowing, the food supply, and our firemen, our EMTs like Paul Pataya, who's on today, and our police officers. What about a number of the invisible services that just keep everything going during lockdown? So we convened a group of world-class people, rapid response team. I'm just the speaker or producer of the work, but we have now over 50 contributors coming from all realms who have contributed to a program that started out as a 30-minute program. It's grown to a 3-hour certification course, and today you're getting a sampler menu, if you will, for families that's specifically focused on families. And you'll see a number of the folks that are speaking today, in addition to nationally known CEOs, a former Assistant Secretary of Health, an astronaut. You see Sully Sullenberger and former leaders at Harvard, Stanford, and a number of organizations. Here's what we discovered. So we undertook this program and put the program together to serve these essential critical workforce for families, and we found out family training really works. We can't just train the employee. The employee is exposed to the virus when they come home. We found out that if we can train the family of the worker, we can dramatically reduce infection. We can save the company, save money, liability, and save capacity. So what you're a part of right now is the family-centric focus, and we've combined medical, clinical, operational leaders in healthcare, law enforcement, and the general public, as well as all faith volunteers. I learned a lot from my church, Saddleback Church, and those that are volunteers, that we really need to do this. We're also doing a lot of research now, and it's really fun. Every day we're adding new organizations. We already have the Mayo Clinic and Matt Horace leading that, along with Casey Clements and Dr. Boats and Chief Adcox at Anderson, Toff Peabody, and Mary Foley, who's a nurse, a PhD nurse, former president of the American Nursing Association, and our wonderful UCI contributors that are on today. We're adding organizations by the day. So I'm almost done with telling you who we are and what we have. Now, when you go to our website, what you see today, videos, there are videos that we have produced that are basic modules that are 4 to 10 minutes, and you can log on your phone and watch them when you're waiting for something, and we hit the pillars of prevention, and then advanced modules that are longer and more technical. And then at the bottom of that web page, we have curated the latest articles from Wall Street Journal, from USA Today, but we've combined them with the medical articles. So if you want to know everything about masks, you can go to one place, you can get the medical articles, but get the overview. We also developed a course using film from major motion pictures. We have the studios giving us the approval to allow us to use clips of Tom Hanks and Sully Sullenberger and Matt Damon and Dennis Quaid and a whole host of others in order to kind of breathe life into the training. Okay, so now let's talk about what we're going to address today. We're going to talk about the hot zone, the warm zone, and the safe zone. The red zone is the hot zone where you're exposed to the virus. The warm zone is where you disinfect. The safe zone is the green zone, and everybody's transition area will be different. The hot zone, you've got to maintain your best protection, and the pillars are critical. Social and physical distance is the most important thing you can possibly do, staying out of indoors whenever you can because of the ventilation issue. Masks are critical, hand hygiene, and there's been some misinformation about contact surfaces. Yes, you need to keep them clean. Not as important as the others, but very important, so keep that in mind. And then the transition zone or the disinfection area is where you take off your mask, where you take off things that are exposed, where you take off the clothing, you separate your laundry, you clean surfaces, so that when you enter into the home, you're not carrying the virus in. And you have to have disinfection stations at the doors at the warm zones. Clean the contact surfaces. Maintain ventilation where you can. Dr. Fauci was on with Harvard School of Public Health yesterday and saying how important it is to keep the windows open, keep the air flowing because of the potential aerosol spread. And then if somebody gets exposed and need to be quarantined, or somebody is infected and they need to be isolated, you've got to create that island inside your safe zone and keep the rest of the family safe. So I'm going to run through these very quickly, and then I'm going to ask Dr. Boats and our nurse infection preventionist, Heather Foster, to respond. But I'm going to hit the highlights. Social distance, 6 feet is a minimum. You'll find in our videos that this is from very old research before we had lasers and we could study how far people breathe and how far droplets could spread, and it's a minimum. Once you see the data, you go, oh my gosh, this looks like it should be longer or further. Hand washing, caregivers, we lose 17,000 people every single year because our nurses and doctors don't wash their hands. So even we in healthcare are not good at it. We have to just keep hammering it, and soap and water is the best thing. Avoid poorly ventilated spaces. We'll cover that later. Don't touch your face masks or face. Once you got the mask on, we touch our faces 23 times an hour. Very critical that when you got a mask on and you take it off, that you don't touch the surface where the virus could be caught. Be gracious but firm when others invade your space. I find myself backing away frequently, but I just say, hey, I got to maintain social distance. It's critical to know how to put on and take off PPE. We call it DOF and DON in healthcare. We've got videotapes to address it. Whenever in doubt, wash your hands, know the process for reporting outbreaks if you've been exposed. And exposure, we define exposure, CDC defines it, and some say shorter than this period, but if you're within 6 feet of someone that is known to be infected for more than 15 minutes, that's exposure. If you walk by somebody who was infected, that's not exposure if you just walk by someone, but if you're within 15, if you're there for longer than 15 minutes within 6 feet, that's key. Now let's talk about the warm zone. Critical. This is a disinfection area. So when you leave the hot zone, disinfect before getting in the car. Contain your contaminated materials. Put them in the trunk. Wipe down door handles and contact surfaces. If the car is the warm zone, it must be considered contaminated. If you can't decontaminate, and for our law enforcement families, if you can't decontaminate at work, you got to consider the car as contaminated. Try to contain it as much as possible. Be ready to store your contaminated gear when you must. When you're coming when you're coming home, you designate what is the warm zone and where you're going to disinfect. Assemble and maintain disinfection stations with cleaning supplies. Dr. Peabody is going to share his with you. Keep the family out of the warm zone, especially the kids. Increase precautions if someone is in quarantine, meaning you're waiting to find out if they might have the virus, or isolation. You know they have the virus. You really have to maintain that. When you join back the hot zone and go back to work, make sure that your mask has a good fit. Fit is absolutely critical. Practice no mask or face touching, meaning you should never touch the outside of the mask. Only you touch what goes around your head or around your ears. face touching is critical. This is why we're wearing shields in the hospitals, because your eyes are moist surfaces that can absorb the virus. If contaminated, wash your hands. Know the rules of the workplace or the public venue. Whatever the rules are about reporting or doing what they require, make sure you know what those are. You have to designate, when you're coming home, designate the worm zone for disinfection, assemble and maintain a disinfection station at every place where you're moving from where things can be contaminated and not. I covered that a little bit earlier. The worm zone leaving home, when you leave home, newer cleaned masks, gloves, and face shields and coverings. You may keep that in mind. You may need to take more with you. Bring disinfectants in your car or your gear, and bring out extra masks if you have them. It's always when you don't have that extra mask that you really need one, or you can share one with someone. Finally, the safe zone practices. Establish and maintain those disinfection stations at the doors. Regularly clean eye contact surfaces. Prevent people or parcels from bringing the virus home. We don't have to obsess as much as we did, but this is still a risk area to keep in mind, and we need to remember those contact surfaces. If possible, keep rooms really well ventilated. And one of the terms that we've used, Nancy Conrad, the wife of the former astronaut Pete Conrad, used the phrase, get your MacGyver on, the MacGyver TV show. You might have to use what you have, and we put this in our course. Now, whether it's the flu, coronavirus, or the next pandemic, they're the same processes. Isolation is for those who are infected or sick. The infected need to wear masks. They need to wear masks in the house because they can expose you. If they wear a mask, they can dramatically cut down your potential risk. Social distance and hand hygiene are important when you're taking care of somebody at home. Surfaces definitely are a risk. And quarantine are those for those is what we do for those who may be infected. We have to kind of assume that they're infected, and so it's critical that we manage that. So it's just a great pleasure to have Dr. Greg Boats join us. He'll have to leave a little early today. He's got major duties, you can imagine, in the ICU at MD Anderson, sickest patients on the planet, and those that are recovering from cancer. It was such an honor to train there when I trained at Texas Medical Center. Dr. Boats is not only on faculty as a full professor there at MD Anderson, but he's also an associate professor at Stanford University Medical School. He's my hero. He finishes a shift at MD Anderson, gets on a plane, and goes to Stanford to teach students and man the life flight and do all kinds of great things to train our next generation of caregivers. And we have Heather Foster, who's an infection prevention nurse. Our next webinar is going to be how to take care of somebody at home. She did a terrific job at helping us tell families what you might have to do if you have to take care of somebody in your home. How do you reconfigure the room? How do you get it ready? Dr. Boats and Heather helped us there, and she's also a winner of the Pete Conrad Patient Safety National Award for her great work. And so, Greg, do you want to go ahead and kick off your process and the things you'd like to share, and then we'll go to Heather, and I can back this up a little bit if you wish.
Absolutely. Thank you, Dr. Denham, for that kind introduction, and I'm happy to be here today to talk about this important topic. I think the first thing that I want to talk about is something that we've covered in other webinars, and that is that along with this coronavirus pandemic comes a lot of fear. It's the fear of the unknown, the fear of the possibilities of illness and death that come along with this very, very serious virus that's sweeping across the globe. But the first thing that I want to impart on you is that by using these tried and true public safety measures of social distancing, wearing a face mask, washing your hands, cleaning your contact surfaces, and being mindful of potential contamination, these things work. If we use them, we significantly reduce the likelihood of transmission in our healthcare workers, in our public-facing workers, our critical essential workers, and their families. I think it's really important that we add in the next dimension that we're talking about today, which is, a disaster management principle of defining the areas in which we work according to the risk. And that's the idea behind the hot, warm, and safe zones. And I think that's critically important as we have people who, by nature of their work, are at much higher risk for contamination and infection with this coronavirus. And so there are some good practices to use in combination between the public safety measures and the disaster measures that makes our ability to manage this respiratory virus much more effective. And remember, the coronavirus, the COVID virus, is a respiratory virus. It's not a bloodborne pathogen. It's not something that can be absorbed through your skin or any other way. It has to get into your respiratory system, and that's through moist membranes. And so by protecting your oral cavity, your nasal cavity, and your eyes, which are the portals of entry, I think that is the key to preventing infection and contamination and spreading it in your family. So I'll give you an example of my process when I leave the hospital where we have a number of COVID patients under our care, and what we do to keep our institution safe, and then how I transition through the warm zone to the safe zone at home. We are very careful at our institution about managing exposure by wearing masks everywhere inside the institution. When we are in patient contact, we wear eye protection, and now recently we've moved to wearing face shields when we are in contact with patients to reduce the likelihood of eye transmission. There are more hand washing stations and more attention to hand washing than I've ever seen before. And as Dr. Denham described before, hand washing is the curse of healthcare givers, just like it is for everybody else. You would think we know better, but our behaviors don't always follow through. And we constantly measure kind of a secret shopper opportunity to look and see who's washing their hands in the ICU and elsewhere in the institution. And we strive for good numbers. I would say that we don't always achieve that, but at least we have the opportunity to identify it and change behaviors. When I leave the hospital, I take off my mask. I have other clean masks in my car. I wash my hands with a hand sanitizer before I get into my car. But I consider my car to be a warm zone. It's potentially contaminated. So I drive home, and when I get home, the chief family officer in my organization, my wife, has a plan in place for me to safely enter into our home. And that involves me taking off all of my clothes in the garage, putting it into a closed hamper, a closed basket, and walking through the house without touching anything directly into the shower and taking a long shower, cleaning, and then emerging from there, putting on clean clothes, and now I'm more amenable to being in a safe environment. That practice is done every day when I come home without fail. I'm lucky that sometimes my wife lets me close the garage door before I have to strip down, but that's for the protection of our neighbors, I'm sure. But it's a good practice to have because we know that the risk of going from a contaminated zone to a safe zone needs an intermediary disinfection area that with deliberate action reduces the risk of transmission, and that includes taking off potentially soiled PPE, including your clothing, washing your hands again, even if you did it just before leaving your institution, whether it's as a first responder in your workplace, when you've had contact with the public who may be at risk for infection, because as we know, there are a significant number of asymptomatic carriers who can be spreaders. And so doing those things can help reduce the fear that we're bringing home contamination, but also can sort of assure that the area that we live in, our safe zone, remains safe for everybody that's in our home. And we also have a plan for if one of us becomes sick or at risk, needs to be quarantined, how we would cordon off an area and sort of set up our own hot, warm, and safe zones within our own home, so that we protect each other to the best of our ability.
Great, thank you. Thanks so much, Greg. That's terrific, and it'll be interesting for everyone to listen to Dr. Peabody and his process, which is slightly modified, and probably yours, Heather. So, Heather, your comments regarding, and I can move the slides around for you as you wish, but Heather, thank you so much again for your great infection prevention work on our full curriculum. What are your thoughts?
Well, thank you, Chuck. I think if you want to just back up to the hot, warm zone slide where it shows the phases, when I'm looking at that, I just think of how healthcare workers are doing that and have been for decades when taking care of patients in the isolation setting. However, it takes it to a new level when we are entering our home. And I just want people to know out there that as healthcare workers, we have the same concern in the very beginning of this pandemic, and possibly even more so as our death rates continue to increase. But by breaking it down like this, it just makes it less intimidating and doable for everyone across the board. For instance, I have kids from 8 to 15, and they want to know, they want to be a part of the solution. So having it done like in a chart form like this makes it something we can print out, laminate, put on our walls as a reminder of what the process is, even within our home setting.
Great. And one of our contributors who is not on today, Beth Ullum, who's an advisor to boards and takes care of a child that has some pretty sophisticated, complex problems, helped us quite a bit with checklists. So we really hope that you watch our next webinar, because we'll be covering those in our next webinar and caring for folks at home. So let's move on and just talk about the second question was, what are the best practices to protect my family? And you heard from Dr. Boats and you heard from Heather the critical issues that we keep coming back to if you watch the news. Social distancing, number one, that great distance, and also staying out of indoor environments where the virus can move around. Hand washing and masks, disinfecting surfaces, and probably distance and masks are number one, the hand washing and hand hygiene, and then disinfecting surfaces. So this is a screenshot of our website. You can go and watch a video that's 13 minutes on social distancing. I'm just going to give you the tasting menu, if you will, and tell you we go through why we've had this incredible explosive spread and how the math works. And when you see how the math works and you see how rapidly just one person who doesn't practice social distancing or mask wearing, one person can infect 406 people in 30 days. And we've got some case studies for those of you that are clinical nurses, docs, pharmacists that want to use some of the latest studies. Our second film is on masks. Now, this was before this enormous amount of political upheaval and partisanship over masks occurred. We put together a basic video, 9 minutes and 34 seconds is the basic on masks. But when the challenges really started to hit us, this is the one long video in our basic modules. It's 27 minutes. On Monday, you will see posted on the website our Survive and Thrive Guide, Masks, the Science of Success. Those of you that know my family, that's my 14-year-old Charlie. During the lockdown, my actors for a lot of our videos were my son Charlie, my wife Betsy, that were great contributors. This video actually covers all the fundamentals and the arguments regarding the mask, which I'll get into a little bit later. Hand washing, disinfectants, 4-minute video, and why soap is so important and how it works. Great for kids. The risk of high contact surfaces, it took us almost a week to sort out the misinformation on the web that was produced that said that the CDC said that high contact surfaces were no longer a risk. That was completely a bogus information, total misinformation, not as important as the other topics for sure, but still critical to maintain cleanliness on high contact surfaces. We touch our faces 23 times an hour. We can pick up viruses that are on surfaces, touch our nose, touch our eye, touch our mouth. And then we also addressed this issue of ICU care. Many people didn't know what respirators are. This is about an 8-minute video, and it also talks about the ECMO machine, the artificial lung that actually helps people like Dr. Boats take care of our patients. Now, one of the things we try to do in the webinars is come up with the very latest information, and what we'll do at the beginning of most webinars is talk about what's in the news. Well, this week, there was an incredible article about a CEO who has flown 33 times, spent 160 nights away this year, is traveling for his company so they're not at risk, and it's a very entertaining article. All these articles that I cite are posted on our website. You can download them and read them in completion, but he talks about what he does in the hotel. He goes into the hotel, cleans every surface, doesn't let anybody come into the room for 4 days. At the airport, he wears multiple layers of gloves, and he just peels them off as he goes through TSA, and he goes through each place. He just peels the layers off. When he's in the plane, he peels them off. He is very careful, and when he's in the rental cars, he will clean the car and then maintain that as his safe zone that is not contaminated. Now, one of the other questions was, what if I'm exposed to a COVID-19 patient at work? Critical that people know. Now, go to the CDC website. Discontinuation of exposure, the time that you're isolated has changed yet again. This happened this week, didn't really make the news. So it's really important to understand what the latest guidelines are, where you work, and what to do. But it's critically important to know that an enormous number of our population are at risk to get the disease and what we do if we are exposed. And the numbers right now, your school, your office, where you work may be less than 15 minutes. Some schools are 10 minutes within 6 feet of someone who has a known positive COVID test. So follow the CDC guidelines. We put them in our videos as well, and what you need to do to know that you no longer need to be either isolated or on quarantine. And they're changing rapidly enough that we have to be really careful not to put them in these webinars, which people will watch later. So we really recommend that you go to them. We're curating our website, and we're adjusting the content in our videos all the time. So those of you that are watching this video on demand, make sure to go to the CDC website for when you discontinue isolation. So what if you're exposed to someone? It's important to understand the difference between isolation and quarantine. Quarantine, you're potentially at risk. You're going to wait out the time period. Isolation is someone that you're taking care of or you're being taken care of that definitely have the virus, could be shedding the virus, and could definitely make others sick. But it's critical if you're in quarantine, to consider you're infected and be very careful around others, wearing masks in the house. When you're in quarantine and you potentially were exposed, you could be shedding virus during that period before you have symptoms, or if you never get symptoms, you could share that with someone in your home. Can we have safe play dates? Absolutely. And for those that are our scout leaders and scouts that are on and scout families, we're working on a number of strategies that will allow us to keep social distance, stay outside, highly ventilated areas. It's a no-no to carpool with other kids because you're basically running the risk of transmission between the kids. The recent studies, we're not going to cover them today because we're talking about bringing home the virus, but the recent studies in South Korea show that kids under 10 have about half the propensity to be get the disease, but they have a lot of virus. They can have a lot of viral loads. So, Mr. Bash, someone like you, the exposure to kids that are asymptomatic and maybe carriers is a big risk. Kids that are 10 years and older have the same propensity to spread as the adults. So it's very, very important to recognize that. Now, why are indoor activities riskier than those in the outdoors? There's a video that Kyle Kemp, our Chief of Staff, is going to play right now that was just released last night, actually, that is a video that addresses a paper that came out of China where one person in a restaurant actually infected others, and it really helps us understand why ventilation is so important. Go ahead, Kyle. Time near each other. Thank you, Kyle. Can you move to the next slide, please? So another article that just came out was an article of the spread from one person who attended a church service and spread to almost 100 people. The graphic you see on your left is actually the diagram that shows the demonstration of the spread. Primary cases are those that were infected by the first case. Secondary are those that got it from those that were at the event. And then the third level are the people that get them from those. So almost 100 people just from one infected person in Ohio. So what personal protective equipment do you need to care for a loved one at home? We're going to cover the mask issues after we hear from Ann Rhodes, who will talk to us about how important it is to get your family together around a family safety plan, and David Beschk, who's going to teach us a little bit about how we can teach our young people. Critical for us to know that those that are in our teens, the 20s and 30s are super spreaders. As Dr. Fauci said yesterday, the good news is 40% of those infected are asymptomatic. The bad news is 40% of those that are infected are asymptomatic. So this is critical, and it's really important that our folks understand that and understand what to do if a contact tracer calls us, and why testing is so critical, which we won't cover today, but we'll cover in a future webinar and kind of break down the tests and what you do with those tests. We have a video on the family safety plan, which you can watch on our program, but very briefly as to set up Ann Rhodes. The game plan is to really focus on readiness, being ready if someone were to be infected, response, knowing what to do if they do respond. So the readiness is just being in a state of readiness. Response is knowing what to do if someone gets infected. Rescue is to know what to do if you have to take someone to see Dr. Peabody in the emergency care department. Recovery is to have a strategy after people are infected or after the community spread is dropped and you want to return to your new normal. And then resilience. And resilience is really making sure that your family is in a state of what we call in law enforcement target hardening. So it's a great pleasure to have Ann Rhodes speak to us today. She was the people system leader for Southwest Airlines, a co-founder of JetBlue. She's the president of People Inc. She's written a bestseller, a great bestseller on Built on Values, and we're so blessed, Ann, to have you share with us about how important it is to get your family rallied around having a plan and their core values. Ann?
Good day. It's so great to be part of this morning. I'd like to make a suggestion to you, though, as you think about the data you're going to hear today, and you're going to hear from many talented presenters, I want you to think about how this happens to relate to your family values. So often we think about personal or organizational values, but what about your unique family values, and how do they support a safety model? And how, on the next slide, how typically do your children find out, and family members, what the real values are of your organization? What they do is they watch how you behave. And we find that most values are developed when we're fairly young. And we develop those by watching the behaviors of our parents, our caregivers, our other family members, and even friends. So watch how you behave around what you're learning today and how that impacts your very unique family values. The next slide. We talk about in organizations and our organizational values, and you heard Chuck today talk about the values of his organization, those 4 critical values. And as leaders of organizations, whether we're leaders in title or whether we're leaders of influence, we drive those values every day, every interaction, and we drive them through the behaviors that are representative of each of those individual values. And I believe that driving the right values and the right behaviors drives success in our organizations just like it does in our families. And I would like to suggest that this is a great opportunity during this crisis to sit and formalize those family values that you hold so dear and that you really want to see become the DNA of the family. I just heard from a great leader that we work with, and he said during this time that the family sat around the dinner table and said, let's talk about what should be our formalized family values. They already had values, but they had never formalized them, and he has 5 children. And he said he and his wife think that it was one of the greatest exercises they've ever gone through as a family. They talked about the 4 values that would be critical to the family, and going forward, how each of those is represented by how each one of them behave. He actually said that they even decided, the children suggested, putting the values over the door that they most frequently exit. So the last thing they see as they go out the door are what those 4 values are that they hold near and dear. I would just like to suggest that perhaps you go through the same exercise. And then to add to that, what they have developed is a story time. When they come home at night, and now that they're all together, of course, and we're all home every day 24/7, one of the things that became important is that they sat together and said, let's start telling stories as part of our routine at dinner about how we lived those values and how we behaved in a way that supported them that day, and to give very specific examples of that. I would just like to say finally that thinking about those family values as you absorb all this great data and information that you're presented with today, I would just ask you to think about this. What are your personal and family values, and how will they help you play the information that you received today forward? Thank you.
Thank you, Ann, and love to have your comments at the end when we have our full group together. Thank you for your leadership and showing us the way. David Bashka is an award-winning educator. He's a joy to teach. We've now taught many courses in middle school and to scouts regarding bystander care and life-saving methods, and now we're fraught with the coronavirus crisis. I can think of no one that I would rather hear from to teach us how to teach our kids these critical issues and couple the values to what they need to learn. David?
Yes, good morning, Chuck. Thank you for the time. So I'm really pleased to be here with all of you today and to share some of my suggestions with how we work as a family and how we teach our youngest how to be prepared for these trying times. As we prepared, as Dr. Denham and I prepared for today, we found this photo here of this family, and I think this picture here really says quite a bit, that family planning is learning as a family, and I think it's important that the youngest in the family see all of us, just as Mrs. Rhodes said. It's the actions that speak louder than words, and you can see here that this young boy and everyone here is working and learning. Dad and mom are actively participating. Everyone is involved, and everyone needs to be constantly learning. This isn't something as CFOs, as the chief family officers of our teams at home. This isn't something that we do once and kind of put it on autopilot. We all need to make sure that we are maintaining a state of readiness so that we can respond if, God forbid, anyone in our family or in our network was diagnosed with COVID. So, yeah, here we go. So I think it's incredibly important. I've been working hard as one of the CFOs in my family to show my family, my wife, and my 3 children just how committed and dedicated I am towards creating a safe environment at home. My wife and I are both school teachers that are looking forward to going back to school, but we need to make sure that we are maintaining a safe space at home, our safe zone that we have created. I've installed an outdoor shower. I just recently created a transition zone that is right adjacent to our washroom so that we can enter the home through the side of the house. We can all take our clothes off, put them in the washing machines right away. We have a new shoe rack where all the shoes that we wore from school stay in the warm zone. We can wash, shower if need be before we ever even enter the safe zone in the house. And so it's been a family activity that my son was actually helping me lay flooring yesterday. And so again, I'm just trying to show the significance and importance to my young children. Just for some context, I have a 5-year-old, an 8-year-old, and a just recently turned 10-year-old child. So as the CFO, and I'm going to be speaking to all of you just as I would any of the parents that would be in my classes, the best ways that we can teach children, the cornerstones of the things that we can do as adults to try to educate their hearts and minds. Number one is we need to be honest. Honesty is the key. Children can see right through nerves. They can see right through if you're trying to, dance around the subject. Just be honest with children, no matter how old they are. Honesty is the key. We need to give children more credit than we often do. They're able to absorb and digest and understand complicated information. Dr. Denham and I have been teaching MedTech to students as young as third grade, formally teaching to students as young as third grade. I've even taught my son when he was 4 years old, actually 3 years old, how to put on a tourniquet and how to put your hands in the middle of the chest and push hard and fast for CPR. We need to be honest with our children, and we need to give them more credit than we often do. That's number one. Another piece when we're teaching children is we need to validate their emotions. This is a confusing time for everyone. We are all feeling various levels of stress and confusion. And like Dr. Denham said, it's like on a daily basis. The numbers from the CDC change. We don't really always know exactly what's going on and how to feel. And that's okay. Admitting that to our children first as the CFO and making sure that they feel comfortable sitting around the kitchen table, sharing stories, sharing emotions, sharing the way you're feeling, sharing questions. That's another key pillar to teaching children in creating safe zones at home. Intentional practice is very key. Making sure that you walk through the steps of coming home and you constantly ask reviewing questions. I really like the idea of creating and laminating checklists and having family reviews and having family critiques where you give, maybe the youngest in the family the power to be the one that's critiquing the practice activities of others in the family, where you have them come in from the car. How did they handle the warm zone in the car? How did they transition into the warm zone in the house? Did everybody do the steps that they needed to? All teach, all learn method. Give everybody empowerment, making sure that we feel comfortable to make mistakes. We're going to make mistakes, but as a family, intentional practice is key, and putting your children in charge is a great strategy to use. It's not always a top-down method. Give them the opportunity to, hey, mommy, hey, daddy, you forgot to wash your hands, or, ooh, you didn't wash your hands long enough. Oh, thank you. Not only does it help reinforce it for the adults, but it helps ingrain it in their minds as the children. And consistency is key for all of this. As many of you know, as parents, the remote learning, decay happens very quickly. I mean, I know it. My wife and I are both educators, and there were days that we just didn't have the fight in us to make sure that all 3 kids got on their Zoom calls or finished their homework. Decay can happen quickly. And one of the mottos around my house, there's not a motto that I came up with, but we use quite a bit, is called discipline equals freedom. And if you're going to be creating these routines, you have to be disciplined and be consistent on making sure that you are upholding these practices to keep your family and your team as the CFO well and safe. You cannot give in. So when we're looking here, we're talking about head, heart, hands, and voice. What is it that we want our children to know? What is it in their head? We want them to know the routines. We want them to be able to explicitly share those, explain what it is that they're doing, and also the reasons behind it. Do not hide the information from them. Children want to know. They want to be involved. They want to understand the ins and outs and the whys of things. Now, we have to be careful to present the information in a way that they can understand it, but at least we're giving them information, and we don't want to be hiding anything. That's the head. The heart, we want them to feel comfortable. We want them to understand that, listen, these times can be a little bit scary sometimes, but that they're comfortable, that their family, their CFO has put in a plan, that everyone is practicing and everybody understands their roles and their routines, and that creates comfort. We also want them to feel care for others, and that what they're doing isn't just for the care of themselves and their family, but this is for care of other people in their schools, their teams, their churches, their communities. Their hands, what do we want their hands to be doing? We want them practicing. You want to be practicing the routines, and again, you get back to that consistency word. Practice consistent routines that you are doing intentionally. And voice. What are the reasons? Why are we doing this? Asking questions. Have them share what the reasons we're doing these routines. Why do we have these warm zone transitions to safe zones? Making sure that everybody can recite the key points. Those checklists are a great way to do that. So I think if we do this, if we're honest with our students, if we are validating emotions, if we are having intentional practice, if we are consistent and we are disciplined, then the head, heart, hands, and voice of our teams are going to be safe, and everyone's going to be doing their part to keep our communities much safer. Thank you.
David, great. And I think you can all see why I just love teaching with David. I think I learned more than the kids about how to teach, and so many wonderful tips. David, you're just such a treasure to us here in Southern California, and thank you for your commitment. Both you and Ann, it's just awe-inspiring to hear you both talk about what we can do with our families. Great joy to now introduce Christopher Peabody, goes by Toph. I met Toph when he was a Zuckerman Fellow, and I was an Advanced Leadership Fellow at Harvard, and I was on faculty at the Medical School and the School of Public Health, and was invited by David Gergen, who was one of our co-chairs, to come and speak to the Zuckerman Fellows. And immediately after I spoke, he came up and said, hey, I really want to be involved in patient safety. And we all know when we give a talk, a lot of people come up and talk to us and that kind of thing. And Ann is such a world-class speaker. I bet she has 1,000 people come up, but Toph was the guy who followed up. He's worked with us on many different things, collaborated with us on WHO and an international meeting and patient safety. He's now an emergency medicine doctor and has done a terrific job of helping us. We put together a few years ago a series of 5 rights program, the 5 rights to surgery, the 5 rights of your medical records, getting them together, the 5 rights for pain management. And when I put together the 5 rights of emergency care, he was the first one I called and helped me put together the real content as a leader in emergency medicine and a graduate of one of the top emergency medicine programs in the world. So make sure that you watch the video of Toph. It's 6 minutes, 10 seconds. It's worth every minute. But Toph, would you please go ahead and just give us a tease, a little bit of a trailer or highlight of the 5 rights of emergency care, and then we'll have you kind of respond and tell us about your method to get home safely.
Absolutely, Chuck. Well, thank you for the opportunity again to speak. I'm learning a ton about what to implement in my family here. And one of the things that we highlight in the video on the 5 rights of emergency care is what you should expect if you need to go to the emergency department in the time of COVID-19. Now, COVID-19 is something that we're talking about now, and it's something that requires a lot of our attention. But there's all the other reasons that you should be going to the emergency department that existed before COVID-19 as well. And so if you need to go to the emergency department in the time of COVID, in the area of COVID-19, what should you expect and what should you know before you go? And we address those things in the video. So I really do think that the update in the time of COVID in this video is worth the view.
Thanks, Toph. And before you talk about the disinfection centers, I think one of the key takeaways to watch that Toph teach us about this issue is you have to leave your family member and wait in the car. So critical that you bring medical records and you bring medications. And Toph, really taught me about discharge precautions and knowing what to do when you need to perhaps come back. So thank you for teaching us that, and thanks for the video. And I just hope everybody gets a chance to watch it. So now have up your disinfection center.
Yeah, so I've appreciated watching, hearing from Dr. Boats and what he does with his transition from the hot zone through the warm zone and back to home. And each one of us has a kind of different way of doing it, but there's some general guidance and best practices that I think can apply to all of us. Now, my process is quite intense. I go through a number of different decontamination before I set foot home, and I think that is because I'm at one of the highest risk places to be with COVID-19 and taking care of patients on the front lines in a level 1 trauma center emergency department. So my process may be a little more detailed than your home process, which is probably right. But the way we went about it, I found to be probably the most helpful, and that is that I sat down with my wife, Kristen, and we just had a baby March 10th. So we welcomed our second child, Josephine Elizabeth, on March 10th, right at the beginning of basically our lockdown here in the Bay Area. I was on parental leave when coronavirus first hit from the hospital. And I was about to go back into the clinical environment. And what we did is we sat down over a series of days and discussed, should I even be coming home from the hospital with a young infant at home? And we talked to a number of different colleagues, sat down, and created a checklist that I use every single day before I leave the hospital, what to bring to the hospital, and how to come home safely. And so the way I do it is that I take minimal things to the hospital. Each one of those little, you can see my little station here. This is in my garage. I have a little cubby hole for all the things that I will take to the hospital. I wipe them down with a Clorox wipe before I go. I put them, all my things, into one wet, dry bag, which we use for carrying diapers around because you can throw it in the laundry. And I go to the hospital. Before I come home, I take off all the scrubs that I wore in the clinical environment and put on clean clothes. I leave my contaminated shoes at the hospital, and I wear different shoes home. Once I get home, I go immediately to the garage. You can see in my decontamination center that I've taped a piece of paper to the floor, and that is my warm zone. Everything that I leave on that piece of in this little zone here stays there, and no one else goes into this corner of the garage. I then again take all my clothes off and put them into a wet dry bag. I hand sanitize multiple steps along the way. I come in with a disinfectant wipe and wipe down the doorknobs. I go immediately to the laundry room. I then strip down one more time, put everything into the laundry room, and then go immediately to the shower. This way, I feel comfortable coming home to a new infant, and being able to practice my family life is very important to me. And coronavirus is something that's going to be here with us for a long time. And so it's not something that I can just stay away from my family from while working on the front lines. So our department just published a paper in the medical literature that basically says that the anxiety that all of us on the front lines have is about bringing the virus home to our families. And so having a system where you feel comfortable being able to come home and participate with your family is going to get us through this crisis. One of my medical students that I mentor and a group of other medical students at UCSF, which is one of the top 5 medical schools in the country, has come together and created a COVID-19 fact check website, which goes through a number of different mythbusters. And this is something that's a great website to reference, as well as the content that you've already seen today, because this one's in multiple different languages. And so if you have friends or other family members who speak a different language, this is a curated website from UCSF that has been translated into, I think it's something somewhere along 13 languages. And with that, Chuck, I'll end and take questions.
Great. And so thank you very much. It's a real pleasure. Thank you very much, Toph. That's really great to see 2 different perspectives, both you and Dr. Boats. Dr. Boats is called away at ICU. So we'll ask you at the end to maybe sum up anything that might be important along with Heather. It's a real pleasure to introduce Dr. Bill Scharf. I met Bill many years ago, general surgeon, got involved in patient safety, became a great leader of a great organization in patient safety and quality, and now has moved to Advent Health, where he's the executive director and clinical director of quality and safety. One of the most well-read doctors in safety and quality that I've ever met. Always is on top of things, and really is a great communicator to leaders. Bill, is there anything you'd like to add, and then we'll ask Paul?
Yeah, Chuck, thanks so much for having me on this call today. Do you know, Ann and our speakers have spoke about the importance of planning and of having values, and also of stories. So I'll tell you my story, and that is that beginning in March, I was repositioned to become part of one of the three clinical leads when our organization had divided up into three different sections, largely based on geography. And in the first 2-hour meeting that we had about COVID, I was thinking, oh my, this is going to get really bad here pretty soon, and we have to take precautions. And the person that I was most concerned about is my mother. She's 84 years old. She's a widow. She is on home oxygen in Illinois, so she's a long distance away from me. But that being said, is that I come from a very, very large and combined family, and so what I needed to do was to get my family on board. That's my brothers and my sisters, and there was a lot of discussions that we had. And I think some of the key points of this is as you're developing your family plans, and that is to do a lot of listening to your siblings and your parents or whoever is involved, repeating back to what you just heard and trying to find common ground. Ann talked about values, and to my brothers who are the truck drivers, the essential workers, the construction guys. It was a discussion about their values of independence and how you could still have independence and still be safe. For my sisters and some of my nieces, it was a discussion. Their values are security. And so we had discussions so that they were not paralyzed by their activities. And so altogether, we ended up finding a common ground. We collectively developed a plan for my mom to put her in a very strict quarantine. But then there's all this other stuff that comes up, and you have to be able to talk through and figure out what's right. So, in the early days, who gets her mail? How does she get groceries? Where does the garbage come out? What do you do about all those other kinds of things? And so I would say is that our families are really complicated groups, entities. No one is the same. There's no standardized family across the board. But in doing so, I would just ask that you consider the principles of risk reduction. There is no one simple silver bullet. A chain is only as strong as its weakest link, and you want to do those kinds of activities that are commonsensical, certainly evidence-based, and that brings families together and not families apart. Lastly, Chuck, I know that you're a recovering optimist, and I'd say there's a lot of great news that's on the horizon. Do you know the numbers that we're seeing across many parts of the country are actually coming down, particularly here in the Florida area. We have where PPE was severe concern back in March. We're seeing a much better supply chain. There's far better access to testing. It's still tight in many areas, but it's certainly much better. We have more effective treatments with dexamethasone, with remdesivir, and with convalescent serum plasma if someone does get sick. And on the horizon, there's everything from antigen testing, antibodies to antivirals, and certainly vaccines. So some really great stuff. And finally, I want to say, too, and that is that, those who fail to study history are destined to make the mistakes of the past. When you look at other public health issues, whether it's HIV or tobacco or seat belts or motorcycles or vaccines, they're all the same kinds of issues. The kinds of behaviors that we're seeing right now it's normal human behavior. It's to be expected. And with normal human behavior, it's just something that we ask our better angels to manage and bring out our very best.
Thank you so much, Bill. I just love that optimistic view, and it's so helpful. And thank you for your great work and your help actually in us understanding some of the PPE issues through your organization. Paul Padilla is an EMT. He's the president of the group at the University of California at Irvine, and we are collaborating in research and support of their group there, and we're so delighted to have him represent the EMTs and that perspective. Paul, do you want to kind of give us the perspective and the view from the EMTs?
Yeah, sure thing. First of all, it's a pleasure to be here. For the most part, PPE is something that our EMT personnel has struggled with in the past. Although currently it looks like it's getting a bit better, what I do want to highlight is something kind of piggybacking off of what David Besh said, which was a pretty important component of family lifestyle, and that component is physical health. So as an EMT, it's pretty important for me to kind of keep myself in good physical condition because, you know, my daily activities involve extrications, lifting, and things of that nature. So I regularly go out with my family members into a local park, try to keep myself physically distanced. And key components there are, you know, make sure you have your PPE, your masks, gloves if needed, carry hand sanitizer, and also disinfect when you arrive home in the warm zone before you actually enter the household.
Great, Paul, and we're going to count on you to help us with the college students and an initiative that we're going to be launching shortly. So thank you. Now we're going to shift gears a little bit. Again, this is a discovery that we made, was that you all may be just representing the general public, or you may be part of a healthcare family, or you may be part of a food supply chain family and work at Walmart or work at Safeway or whatever. We thank you, and we're so honored to combine audiences. And now we're going to take a little bit different tack and hear from two of our best security leaders, law enforcement leaders, and just plain leaders. And their constituency, almost 300 officers at the Mayo, across the Mayo Clinic, and 300 officers, and representing the care and safety of more than 20,000 people in Houston. We have two leaders that are going to respond regarding their medical centers, and we have a leader, Randy Steiner, who's also an assistant scoutmaster, but also the director of emergency management at the University of California, Irvine. And we like these three gentlemen, starting off with Chief Adcox, who's the chief of police and also the chief security officer at MD Anderson, and where we're doing a number of research projects, and you'll be subjected to a survey at the end of this program to help us inform this community of practice that we're building and growing. We've got more than 400 families on, and we have multiple organizations now that are undertaking the research on the 5 R's of that we addressed, of readiness, response, rescue, recovery, and resilience. And so it's such a pleasure to have Chief Adcox speak on behalf of our law enforcement. And I can toggle around to the slides, Chief, if you wish. Matt Horse is the Chief Security Officer of the Mayo Clinic and the Enterprise-Wide Risk Management. He's a best-selling author and also has a personal story to tell you about COVID. Another terrific leader. We're so honored to have both of you there. And Randy Steiner actually is an inspiring leader who actually went through a tragedy of a plane crash as a young person, and then dedicated his life to be focused on emergency management. And Randy, you've been such a great addition to our community in Orange County, and actually helped us teach our search and rescue merit badge program for our scouts, which was just terrific. So we love having all three of you gentlemen now kind of speaking to your own audience, but kind of giving us a little bit of a view to the rest of us in the public of this high-risk enterprise that you are having to manage, where your officers, and this slide I'm backing up is from the Chiefs Association, that is, I think, a very well-written document we'll post that addresses what you have to do in your space. So, Chief, would you please kick it off, and then Matt, and then Randy.
Well, Chuck, can you hear me?
Yes, sir.
Thank you so much. It's an honor and a pleasure to be here today and to be with this distinguished panel. We in the front lines here, in terms of what we do for a living, one of the things that we have been very cognizant of is that we know that it's extremely difficult, if not impossible, to care for others and to support and protect others if you are worried about your own family and what's going on in your home. And that's why this program, and that's why all this information is so critical to how do we go through the warm zone into the hot zone and then back into the green zone. How do we protect our families if something happens? So it's very important. We've had to do a lot of things. We call it the Big Four in our organization. We call it distancing, shielding, time, and hygiene. You know, you got to have the social distancing. You've got to make sure you have your face mask. if you have a face shield, you have your eye goggles. You have to have time so that you spend as much time in the safe area in the least amount of time around individuals in which you can become infected, and also hygiene, continuously washing your hands or wearing protective gloves. We talk about the methods that we have determined to be most useful. We've changed the way that we meet. We meet outdoors, quite frankly. We have separation. We've gone to multiple shifts. We don't have people traveling in the same areas at the same time. We've equipped our personnel with the protective gear that they really need to have, particularly when they have contact with the general public, particularly in the high-risk areas with N95 masks. We do a weekly check-in. We check on their health. We make sure we have both vertical and horizontal communication with multiple communication mechanisms, particularly in today's pandemic era where you just can't walk up and shake a hand and see how someone's doing. And we make sure at all times that we have programs and support in place for all of our personnel. And we follow what you pointed out there in the IAC bulletin. We keep up with all the work that's being done with MedTAC and in this particular group that's come together for these safety measures. And so I will tell you that I'm very appreciative of being part of this and very appreciative of all the work that's being done. I'll turn it back over to you, Chuck.
Thank you very much, Bill. And we're keeping this brief so we can go to everyone. But Bill is also a pioneer of threat safety science, and Matt is also involved in an emerging threats community of practice that we've launched with the top medical centers in the country. Matt, would you like to share your thoughts and story? And we know you have to be off at the half past, so we'll go right to you.
Well, thank you very much, and thank you, Chief Adcox, for your partnership and continued concern. I'm finding that what I'm learning most is that we have to be concerned with our staff and their families, even more so than the execution of the mission. And, the other day I spoke with a security manager in Atlanta who works for a public contracting firm, Allied Universal. And he was telling me that he has a 6,000 person workforce in Atlanta for commercial and, commercial properties, schools, hospitals, and et cetera. And he said that they're experiencing a 15 to 20 person per day infection rate out of a 6,000 person staff. And when you start to think about the impact as a result of isolation and quarantine and infections, and then having to execute security plans, it's really substantial. So here at Mayo, we've been trying to do the best we can to ensure that our frontline people don't get infected. And when they do, obviously, they're taken off the rolls. But through all that planning and all that execution, I actually contracted COVID about a month ago. We believe that I got it from my daughter, and my wife ended up getting it. So throughout the learning cycle and the learning experience, we kind of learned what it was like, the difference between the real and the imagined. And I was able to communicate what happened to me and my story to my staff as well, that this can happen to you. We're making plans throughout all of our destination sites for when and if we do have an outbreak. I, like Bill, I'm sure, are really concerned that we don't have one person that catches it, but we might have one person that catches it and community spread. It might turn into 3 and 5 and 10 and 50. And that's a real concern being a leader of our enterprise function. So I would say that moving forward, I'm going to count on you a little bit more, Chuck, in terms of educating our frontline staff. We're going to continue to do the best that we can to protect them and their families. But I've definitely gotten a couple of things I'm going to take back to them in terms of how they should be leading their lives once they leave work.
Thank you, Matt. And it's shocking to me that the CDC guidelines, when they are adjusting isolation and quarantine guidance and guidance regarding getting back to work, that we're not seeing it on the news. And since we don't see it on the news, we don't hear about it. And even our frontline doctors are unaware of it. So the content we're curating, we're finding that it, in our webinars we're doing on the third Thursday of the month, that we're going to have to keep updating that because we've got to get that message out that the science is changing so rapidly. Matt, thank you for sharing your story with us, and it's great to have you. And congratulations, actually, on Mayo Clinic #1 again, U.S. News and World Report, and Chief Adcox, MD Anderson #1. Both of you #1 slots in the most important ranking we have in the United States. Randy, it's just such a great pleasure to have you on and to work with you here at UCI in our Orange County environment. And thank you for the contribution and also being involved in our research project, as is Matt at Mayo and Chief Adcox on these 5 Rs. Randy, what would you like to add to what the other gentlemen have said? And then we're going to move on to cover some of the really important updates on masks and then give everybody a chance to comment before we close.
Thank you so much, Chuck, and thank you for the opportunity to be here to speak on this distinguished panel. Really, I just wanted to build off of what Matt was saying a little bit about the planning process. You know, when COVID came, our disaster planning process was really based around, you know, the wildfire scenario, the earthquake scenario. You know, although we have in UCI, we have a very robust plan. We do have a pandemic annex. One thing we learned very quickly as this event started to really, you know, evolve around us was that plan was really conceptual, and the reality of what was needed to deal with a pandemic type issue like this one, we really kind of had to start building that plane while it was taking off of the runway. But, you know, some of the principles of planning are really important, and having that plan, first of all, having a plan is the most important thing you can do, is developing that plan, not just, you know, from a professional organizational viewpoint, but as a family, as a you know, individual in society, having some kind of plan to protect yourself. Just make that plan. That's the start of all of it. But also remember that, you know, plans have to be, emergency plans particularly, have to be scalable. They have to be flexible. They have to be adaptable. You can't plan everything in detail. You have to have a good concept of what you want to do, but you also have to have the ability to adapt that plan as the situation grows. In the Marine Corps, we called that Semper Gumby, always flexible. Remember that in your planning process. And lastly, I just want to throw one of my favorite planning quotes out there from General George S. Patton that says that a good plan vigorously executed now is better than a perfect plan executed 2 weeks from now. So keep that in your minds when you are developing your plans, but have that plan and make sure that you can adapt that plan as the situation evolves. And that's what we're doing that every day with this situation, and as we get through COVID. So thank you, Chuck.
Well, Randy, and thanks for the leadership that you have with our scouts. We know we have a lot of scout leaders and scoutmasters and scout families on, and the search and rescue merit badge was so instructive to the kids that we had involved, and I think combining that with the COVID challenges of bystander care and Good Samaritan care is so critical. So what I'm going to do now is there's some critical things on masks that we want to cover, and then we'll go round robin to each of our speakers, and we'll also put our survey up on the 5 Rs. We pray that you'll stay on and do that quick survey. It's just take you 2 minutes to do. But one of the most important things is that the mask issue is becoming even more important. The risk of airborne, the virus going airborne, which are in droplets, the 5-micron droplets that drop nearby on surfaces, the less than 5 microns that float in the air that become aerosols. But now we're starting to, with some of the researchers, and we heard this from Dr. Fauci yesterday, that the larger droplets are going further. So take a look at our repository. We're curating content all the time. There's an article here that could help protect you from buying masks that will not be as good. The idea of an N95 mask being the best is probably not best for typical consumers, and a K95 mask is from China may not pass any of this or pass the filtration test. So this document that you see before you, we're going to release on Monday. I'm going to revise it again over the weekend because of the latest information. And we start off with some of the facts and fiction regarding masks. It's kind of fun for those of you that know my family, my wife and son. We created line art drawings because we didn't have access to a lot of people when we were building the content. The best solution is all wear masks, but the N95 for caregivers, because they need a fit test. If you don't have a fit test, you can't guarantee that you're going to get the greatest value. the medical surgical masks that are of high quality are the best for us and consumers, but cloth has a real impact. So remember, no mask is extreme risk. 15 minutes within 6 feet, large droplets, small droplets, aerosol are all at risk. If we talk about the cloth masks, pretty powerful. A 2-layer cloth mask reduces the exhaled and inhaled droplets by 60%. One paper says that if we were to wear 2-ply cloth masks across America, 60% of the time we could stop the epidemic. That's an amazing number. The surgical mask reduced exhaled droplets by 99%, the good quality ones, and inhaled droplets by 75%. So you're not wearing a mask just to protect the community. It has 75% is a pretty good number when you think that viral load is what determines whether you get COVID-19. So the sum up here is, and watch our video, the 27-minute video. We'll be editing it again by Monday. The science is changing all the time, but a good surgical mask that is fitting well, that you are not touching with your hands, can probably offer you and your family the best protection, and not to worry about an N95 mask because they absolutely have to be fit tested so no air is moving around outside of them, or you can't get that 95% protection. So these are the graphics that we have in the video. We hope you enjoy them, and we'll be posting the article, which I'm revising over the weekend, that has the detail. 2 slides here, slide 91 and 92 are for our doctors, medical students, nurses that are taking tests. This is the evidence-based content regarding these issues, and you can see the cited articles. All the articles are on our repository, and anybody in the public we'd love to have you read them. You don't have to, but for those that are getting a certificate with us, this is what you need to know to be able to pass the test. So I'd like to go to John Tomlinson now. John is a scout leader. He's the chair of our particular troop. Wonderful man with who's trained as a lawyer, as a businessman, but also as a great community leader, a faith-based contributor to his church and his community. I've known John for many years. His son and my son are the same age. He constantly inspires me, but we had the opportunity to challenge a mask issue in his community. And John, I'd like for you to share that quick story and then how you created your own isolation chamber at your home.
Very good, Chuck. Thank you, and I'm really enjoying this program, by the way. Great presenters. I work in the multifamily housing industry, and we provide rental housing for people. And when they have a maintenance issue, we have to go in and fix it because if the toilet's clogged or their electricity's out, we need to go in there. So some of my employees, for various reasons, decided they didn't want to wear a mask, even though the company mandated it. It was ordered by the health department of the state of California. So I enlisted Chuck's help, and we shared with some of my employees this video regarding the science behind masks. And within several hours, they put on masks. So it was a real victory, and just to keep, and I think we used the example, hey, you're not only protecting yourselves, you're protecting your loved ones by wearing a mask, because you don't know what you're going to do if you bring COVID-19 home to your loved ones. So I think it really hit home, and I thank Chuck for his help on helping our industry, the apartment industry, face these challenges. So my story about, there was a movie, Apollo 13, and I've watched it several dozen times, and the part that intrigued me most is when they had to go into the LEM and they had to use what they had on hand to filter the air. And I started thinking, it's like, well, what happens if one of my family members gets sick? So I had this little 13-foot trailer that's fully self-contained, and it plugs in, and it's got its own air conditioning and heating and water system and shower. And I thought, I'll use that as an isolation unit at my house. So I put it in my driveway and plugged it in, and I affectionately call it the LEM 2. So,
thank you, John, and we'll have to put the picture. We'll have to use the pictures the next time as we talk about the family plan, which we're going to cover on care of our loved ones at home. So, what I'd love to do is have you all take a look at the survey, and please respond to the survey that we've addressed. What I want to do is I'm advancing the slides to take us to each one of our contributors. Jennifer, Dingman, you'll be last, and we'll have you close because we always want to close with the voice of the patient. But Dr. Boats was called to ICU. Ann, would you like to make some concluding comments on what you've heard? And you always inspire us, so I know you'll have something to say. What if we lost
my own
Ann?
family? It was the greatest. I just enjoyed today. I learned so much for my own family and for friends and others that I plan to play it forward for. Thank you all for contributing. And this is all about, every one of you showed your personal values today, and thank you so much.
And thank you. And I want to just let you know, for those of you that are going to take our certification course, Ann, Jim Collins, who wrote Good to Great, a number of leaders, including Sully Sullenberger, and many great leaders that you know are featured. And Ann is, I think, one of the really terrific instructors of that part of that module for our certification course, and that's for law enforcement, faith-based individuals, those that are doctors, nurses, pharmacists, continuing education credits. Thank you so much. David, my call sign for David is Eagle because he embodies what I think an Eagle Scout becomes as a great man. David, what else would you like to add? And thank you for your instruction on how to get to our kids.
Well, thank you again for letting me be a part of this wonderful webinar. What I would like to share again is I think it's very important that everybody understands the significance of what we're doing and that we are honest and that we are dedicated and that we are disciplined in our pursuit to helping teach and helping to bring better understanding towards ways we can remain safe. And just remember to keep care in our hearts and fight the good fight. And if we have questions, ask. There's nothing wrong with saying, I don't know the answer to something, and trying to find that information so that we can be better CFOs for our family and our community.
Thank you, David. Thanks for your leadership here. Heather, again, Heather was a wonderful contributor to the deep dive content that we have built for our more comprehensive courses on how you create a care room at home when you have to take care of someone. When we hit these surges, not everybody's going to be able to go into a hospital, and you may be on the fence in terms of symptoms, and we'll ask Dr. Peabody to kind of maybe address that. But Heather, thank you for that wonderful contribution. What else would you like to add, Heather, as a nurse preventionist and a leader in the community?
Well, you're very welcome, Chuck, and it's a privilege to be a part of this process. You know, I was just reminded of something. John, when you mentioned your camper, you know how many times I've walked past my camper and it has not dawned on me to make that an isolation room until you said that. And so I think it's important that how many expertise we have on the front line, we can learn from one another. We can definitely make room for that. And so I think as we go deeper into this pandemic and hopefully come out better for it on the other side, that everyone's self-awareness is mastered through this. And again, I just want to thank everybody for your input. And John, I'm going to do the very same thing to my camper. Thank you.
There you go. Thank you. Thanks, John, for that. Toph, concluding comments and anything you want to add regarding emergency care and perhaps what we need to know if we've got to get somebody in.
No, Chuck, I think this webinar covered everything that I'd like and more than, and so I've learned a lot today, and I would just encourage people to sit down, spend the 30 minutes that it will take to talk with your loved ones about what your personal plan will be to go through the long haul of this pandemic.
Fantastic. Chief Adcox.
Thank you very much, Chuck. The only thing I would like to say is that this is a tremendous program and information. Remember, family first, people always, take care of one another, plan, watch out for each other, and we will get through the pandemic. Thank you, Chuck, for having us as part of this.
Thank you, sir. Thanks for your great contributions. Matt, are you still on? I think Matt had to be pulled away at Mayo. He texted me. I think he did. Randy, anything you'd like to add?
Chuck, just thank you so much for your leadership and putting this out here, with all the programs you've been working on, and the planning that we've been going through for the last year, in our relationship, how it's kind of evolved into, into this event has just been really outstanding, and just the dedication of everybody, not just on this panel, but everybody is doing their part to really work through this using good science-based approaches to helping to stop the spread. If we continue this type of leadership, we will get through this, and I just want to wish everybody the best of getting through it and stay safe.
Yeah, and Randy, thanks again for your leadership in getting the families of all your officers to contribute to the survey so we can inform this program, and the emergency medicine department that'll be on one of our next webinars, Dr. Katz or Dr. Fox, and the great emergency medicine leaders. Paul, anything you'd like to add, and any tips on getting to young people? You're our youngest person on the panel.
Yes, I am. As for tips for young people, it is, you're very correct when you said that, people my age, 20s, 30s, that tend to be kind of resistant, skeptical with mask wearing and social distancing. I would just recommend to the people my age watching this is just, authorities know what they're doing. And I've learned a lot from this program, and I'm more than excited to work with you, Chuck, to execute our MedTech program at UCI.
Great. And we have leaders from University of Florida, from Chapman University, Stanford, Harvard, that are all participating in our young persons approach. So I feel honored as an old guy to be at the table with you guys. Bill, any other concluding comments? We'll then go to John, and then we'll have Jennifer. You'll be our anchor person to close us.
Well, for anybody who's on the call, you don't have to be Monet to make an impression. You can make an impression by leading by example, as you heard on the call today. You can make an impression, definitely make an impression by leading on stage. But you can make your most impression often by leading off stage. And I encourage everyone who's on the call to lead through this pandemic crisis. And I want to thank you, Chuck, and everyone on the call for all the work that you guys have done. May God bless you all.
Thank you, sir. And John Tomlinson, anything you'd like to add? It sounds like you've got some sales for your isolation trailer.
No, I'm glad to be part of this panel, and thank you so much. I've learned a lot myself, and we can all do our part. We can all take a responsibility and do our best to keep everybody safe.
And thank you, John, for your help with the Adopt a Cove program. We're halfway to our goal of getting every cove from Dana Point to Newport Beach at 3-minute response time with automatic defibrillators. And thanks for your leadership of Scouts. So Jennifer, we're leaving Jennifer for last, but last is not least. Jennifer is just one of the biggest champions of patient safety. Every other week, every Saturday morning, 7 o'clock East Coast time here, we have an hour call with patient safety champions. She served on many federal organizations. She's been a co-author with us, but I think most importantly, one of the silent leaders that helped get the hospital-acquired conditions program across the goal line. And it finally came out this last year. Over 175,000 lives saved, and in the $20 to $30 billion saved for our country. So, Jennifer, you and the team and Saturday morning team that you represent, thank you for always being the voice of the patient. Would you please close us? And if our speakers can stay on, we're just going to do a quick process improvement loop to see if we can do anything better for you. So, Jennifer, would you close us? And God bless you all. We'll see you hopefully next first Thursday of the month. You're going to learn about how to take care of someone at home. Jennifer?
Thank you, Dr. Denham, for your very kind words and for putting this together for patients and families and the public. It's well needed in our country. I just want to thank all of our speakers, the experts, the people who follow science. It's very, very important to our listeners today and the people viewing this webinar that you listen to the doctors, that you listen to the scientists. This is very important. Our lives depend on it. Our future depends on it. We will get through this together with the help of the good Lord in heaven. But we do need to be sensible, and we need to listen to the science. And I encourage you to please listen again when this recording comes out. Take the recording, share it with your family, your friends, your coworkers, and help this to grow in our communities. Help this great webinar series to grow. Again, thank you so much, and God bless everyone here today.